I started general dentistry in 1987, graduated from West Virginia University School of Dentistry. Mainly, I did what we all seek out to do, some more crowns, some more implants, some veneers, try to have a successful practice that can feed my family and I get to afford some of the nicer things in life and save money for retirement.
Sure.
After doing that for 33 plus years, I was kind of getting kind of burned out on dentistry the way a lot of dentists do. So I started attending classes and learning and getting more knowledge. And I started trying to implement it in my general practice. I would screen patients. I would have posters in the office. I would talk to patients about the symptoms they were having. I would look for the oral symptoms. And slowly, we were treating some sleep apnea patients. But I was too busy doing implants, crowns, veneers, root canals, and everything else. So it was just another part of my practice, which there's nothing wrong with that. It could be a very good adjunct for most people's practice. And then about 18 months ago, I sold my general practice and I realized that I didn't want to retire 100%. So I moved to a resort town, which was 125 miles away from where I lived. I opened up Almost Heaven Sleep Solutions from scratch. I didn't know anybody. I didn't know any doctors. And I started trying to seek out and find out how I can get sleep apnea patients in my practice. I didn't know a soul. I didn't know a sleep physician. I didn't know a pulmonologist. I didn't know a cardiologist. I didn't know any primary care physicians. Nobody.
Yeah. Wow. When you started looking for ways to generate more patients, how did you find us?
Well, I'm a big internet surfer just like everybody else, and I like Facebook, and I tried to keep a Facebook presence and stuff like that, but it wasn't really drawing me a lot of patients. I was paying someone who was a nice guy, but he wasn't delivering.
Yeah.
And I was already giving him an ultimatum that if I don't have any new patients coming in by next month, you're gone, okay? And we're still friends today, but he doesn't work for me, okay?
Yeah.
So I'm surfing one day on Facebook, and I happened to see this ad pop up, and it says, you've gone to classes, you've learned how to do everything. They told you that patients would just be coming to your door and you would be getting and treating patients. It's not happening. And it said, we can deliver patients to you, sleep apnea patients. And it was your company. And so I gave you a call and we hit it off. I liked what you had to say. You were honest with me. And we started working together and been doing it ever since.
Yeah. And this was back in March, I think, when we first started. I think March was our first full month working together. Yep. And can you tell people what you did? And that's when things shut down.
That's when things really, as you would say, the proverbial stuff hit the fan. Okay.
Yeah. Yeah.
So when that came, I knew that there was not going to be an influx of patients and things like that. And that's when we started working with you, doing the Facebook landing page and putting my ads out there at your guidance. What should we put in an ad? How do we word it? What do we want to breach the subjects? And then we would get, 20, 30, 40 hits, and patients would give me their information, and then I would contact them and we would go from there.
Yeah. That's great. And have the results, they've been keeping up? Like every month you have a reliable source of new patient opportunities?
You hit the nail on the head.
So that's great. So what did you guys end up doing in the way of revenue in the month? I think it was March when things shut down. What did you guys end up doing?
I think in March we did about $20,000 that month. And it was all primarily because of you. I had yet built up a good physician referral base yet. It's still slow coming on the go out and meet and shake hands and press the flesh and stuff, because they want you in their offices March, April, and May, and June.
Yep.
So this was a way of getting good contacts, people that they know they've got something wrong. They know they snore, or they know they wear a CPAP and can't, or try to wear a CPAP and can't.
All right. Well, I think that's all we have. Man, I appreciate your time, Cuffy, and we'll be talking soon. So
I appreciate it, Todd. You've done a great job for us, and as you know, every time you call me to talk to somebody, I'm really willing to do it for you.
Awesome. Well, I appreciate you, and thank you for delivering so much value today.
Thank you all.
All right. We'll talk to you soon, buddy.
All right, bye.
Bye.